Good evening. My name is Vonetta Michelle Williams. I am a resident physician at the University of Washington Radiation Oncology Department, PGY Year 4. The title of my presentation is Simulation-Based Learning for Enhanced Gynecologic Brachytherapy Training Among Radiation Oncology Residents. Brachytherapy is a critical and irreplaceable component of cancer treatment, particularly gynecologic cancers and cervical cancer. Brachytherapy training in residency is highly variable, and procedural exposure has been associated with resident confidence in practice. The goal of a study was to determine if a comprehensive simulation-based gynecologic brachytherapy training experience among residents could improve resident knowledge, procedural confidence, and interest in brachytherapy. The design of our trial: 2 months prior to our workshop, radiation oncology residents at our program completed an anonymous survey, which consisted of qualitative and quantitative questions. Questions assessed brachytherapy knowledge, implant procedural confidence, dosimetry, plan evaluation, and quality and safety protocols. 2 months later, residents then participated in a 4-hour-long gynecologic brachytherapy workshop. The workshop included lecture components from radiology, physics, and a radiation oncologist. Following the lecture, there was a hands-on training component with different stations, including applicator selection and placement, using a pelvic phantom, target segmentation, and physics quality assurance. After the workshop, the same questions that were completed prior to the workshop were again collected, and descriptive statistics and Fisher's exact tests were used for data analysis. The sections included learning environment questions. As you can see, post-test, resident answers to the learning environment questions improved following the workshop. Baseline knowledge and comfort also improved, with the exception of number 3, the question, I feel comfortable performing this procedure independently. Resident impressions on the future of brachytherapy were consistent. Pre and post survey, residents identified lack of didactic and procedural training as the main reason for decreasing use of brachytherapy nationwide. Other answers that were significant were a lack of personal interest in brachytherapy and expanding use of SBRT boosts. Knowledge-based questions. Overall, initially, 1 out of 8 residents was able to successfully or correctly complete the knowledge-based questions. Following the workshop, 6 of the 7 surveyed residents were able to successfully complete those questions, and those are listed on the slide. In conclusion, there was an overall improvement in confidence and knowledge following completion of the workshop, and we believe that this workshop has the potential to provide a framework for brachytherapy education in residency. The next steps would be to incorporate this workshop into our yearly didactic schedule, and long-term we would like to partner with other groups doing similar efforts in addition to the ABS 310 training program. And these are my thank yous.